We all know the difference, except for the geographically challenged, the difference between boundaries between California and Nevada. But when it comes to boundaries between face fillers and facelifts, I don't think the boundaries are so clearly defined. Are they? And is that causing you guys a problem?
You need to have a thoughtful dialogue, right? We don't live in a black and white world, we live in a gray world. So sometimes what I see and what I perceive is not what they perceive in the mirror. And I think it's really important to talk. I mean, do you agree?
Yeah, and what I think is really important with the patients is to not let them keep using volume to deal with sag. And that can be what's happening is you see a 70-year-old that comes in who's never had any facial procedures who wants filler. And that can be really challenging, and they expect a facelift result, right? So it's not wrong to go ahead and really recommend a facelift. It's not always better to say, well, we start with fillers. It depends upon when they come to see you and what they're expecting out of the final results.
Are you seeing patients today who haven't had anything done, who come in and it's time for a facelift?
You know, we work as a team in my practice, so I'll have my facial filler providers come in and say, hey, I can't do anything with this person anymore. You know, and I've told them, and we really need to do a surgical option at this point because it's a waste of their time and it's a waste of their money, and we want to get good results and not try to make false promises.
And I think that's, you know what, when you just mentioned that, a waste of time and money, because I think when you go to, sometimes patients find themselves at a spa, they may not be a plastic surgeon's office, and they're sort of sold a bill of goods for what they offer, which may just be fillers, right?
I think people appreciate sincerity. And I think if you sincerely have good conversation, good dialogue, and just ask what they, you know, what do they want? What do they want downtime? What can they do? I think people are very reasonable. So I just think you need to have that honest conversation.
If you'd like more information, go to theplasticsurgerychannel.com.